The secret to restoring movement is an idea and a concept that you're probably quite familiar with. However, in this video, I want to change your perspective on that and change your lens on how you look at that so that you can better coach it and better educate your patients and clients. To me, the secret to restoring movement is through movement variability. Now, when you hear movement variability, you probably think of your patient or client being able to move through different ranges of motions, to perform different exercises, and have that variable motion. But what I want to do is to use an analogy and to get your gears turning a little bit differently. So like we mentioned, you can coach, you can utilize it, and you can train your patients and clients better. Before we go into that, I need to give a little bit of a backstory, and these concepts are straight from our Performance Redefined course, which is our continuing education course for physical therapists, strength and conditioning coaches, and personal trainers. And what I want you to realize is that there's really only two movements that we move through. One is external rotation, and the other is internal rotation. How we move through just these two is that there's coupled motions that come under that. They are other motions that follow ER and IR. But for simplicity's sake, I want you to just think about ER and IR. And I want you to think of a number scale. And on one side of the number scale, you have ER, external rotation. And on the other side, you have IR, or internal rotation. What this means is that when a patient or client comes in to see you, they are all on varying degrees of this number scale. Someone might be super close to the ER side. Someone might be super close to the IR side. Someone may be just biased a little bit towards the IR side. And the differences there are the super dysfunctional versus someone that has just a little bit of room of improvement, right? So we see these people on day-to-day basis, and what we do is we label different postures, but what's happening is they're biased towards one side or the other. So this creates movement expectations, and this creates them to be good at certain motions and bad at certain motions. Now again, that's the brief description. I would really encourage you to check out the Performance Redefined course where we go into much more detail about that. But now that we understand our number scale, I want to take you through a quote that Ron Haruska said, who is the owner and founder of Postural Restoration Institute. And he said that when you stop pumping, you die. Now, you can take this quite literally. If your heart stops pumping, yes, you would eventually die, right? But what he means is when you stop pumping efficiently, you have dysfunction. What does that mean? Well, you can start to realize that the body is just a bunch of pumps. You can literally go through the body. So if the heart stops pumping efficiently, you have dysfunction. If your lungs stop pumping efficiently, you have dysfunction. If your GI tract and your blood vessels stop pumping efficiently, you have dysfunction. If your arms stop pumping when you are walking, running, or sprinting, you have dysfunction. If your pelvis isn't able to pump reciprocally, you will have dysfunction, right? So all we are a bunch of pumps. So when someone comes to you as the movement professional or as the clinician, and they're in pain or they're trying to increase their performance, you need to understand, where is that dysfunctional pump? When you can restore their dysfunctional pump and bring it back to the efficiency that it needs, you will restore movement. You will get that patient out of pain. You will get that client moving better. You will get that athlete performing better because they have their whole variable movements, and you've now increased their movement capacity. Someone that comes in and they're very one-sided on their number scale, let's say they're very one-sided on the IR side, they have a very limited range of movement available to them. Their movement capacity is small. Our goal is to increase movement variability. I think a lot of us know that. If you're in the field, I think we know that. What we struggle is we don't know how to get there. We don't really know the why behind why is that capacity so small, right? So we're a bunch of pumps, and we need to get our patients better at pumping. So when you understand that, it becomes a really simple game as to how we get our patients moving better, how we restore movement. If someone's very limited on the IR side, we have to restore their ER pumps. If someone's limited on the ER side, we have to restore their IR pumps. And that's what the Performance Redefined course is all about. And that's what we go into, how exactly we restore people's pumps so we can get people moving and feeling better again. So that's the big secret of restoring motion. And I encourage you to write your questions down below. If you struggle to keep up with these ideas or something didn't make sense, I'd be glad to answer that in the comments. And I also would encourage you to subscribe so you can see more videos like this so you can become a better coach, a better clinician, and a better trainer.